Testing microphone. I'm not even sure if it's working, but right. 4 more minutes to go. You can grab a coffee or anything. I'm just gonna reply some messages before I get started as well. Three more minutes. 3 minutes to go. I really don't want this to be more than 1 hour or maximum 1 hour and a half because I don't think I have that strength to be honest. To be live for more than 1 hour 30 minutes. We'll just wait for others. We've got 2 minutes to go and we'll get started. All right, it's 6 o'clock. I think people will be joining us from now. I'm just not sure if you can hear me, but uh, let me try and find that out from my other accounts, just to be sure I'm not the only one talking. Can you hear me? Can you hear me? Perfect. So that's absolutely fine. That's absolutely fine. I'm glad I'm loud and clear and people can hear me. I'll just wait for a few more people to come now, so we can get started. But what I'm not sure is this actually recording or something? I just need one more person to. Waiting for a few more people to come. All right, we're still waiting for a few more people to join. Actually, we have three people now. I'll wait for two more. And once I have five people, I'm okay and we can get started. All right. So we have two options. Either we wait 2 minutes more, we'll start by 5 past 7, or we start when we have more people joining us. And then I'm not sure, I've not done YouTube live before, so I presume it should save to my channel. If it is, I'll be really glad, but I'm not sure if it will because I can't see anything like that here. Well, yeah, one more minute and I'll just start. Thank you for waiting. It's just African time. People like to come a little bit late so they can start immediately when everything is just starting. But yeah, one more minute and we'll start. It's just to allow more people to start so that more people don't miss the introduction. Well, I believe this should be recorded. I'm not sure if it is, but yeah, hopefully it will be. Mm, All right, so it's 6 now. Let's start. Welcome to today's session. This is my first session of many. Of course, obviously, I'm planning to get started with this session so I can get engaged with people, especially nurses from Nigeria, from Africa, and I'm in the UK. So we can discuss and talk about what happens in the UK if you have any questions or concerns and stuff. Because recently, I know agencies and stuff that getting money from people just to help them get into the UK. So I want to take on that responsibility to try and help as much as possible. Uh, so my name is Lukman Kazim. I'm known on almost all my social media handles as Intrepid RN. Um, I'm on Twitter. I'm on YouTube, obviously. I'm on Facebook. I'm on, where is it? Threads. Yeah, I'm on Threads now, and I'm on Instagram. So you can follow me, watch my previous videos. I do a bit of vlogging, nursing and stuff now. So you might see mixture of content on my channel. That's absolutely fine. That's what I do. So let's get started. Once again, I'm Lukman, Intrepid RN. I work in the UK as a nurse. I've been here for over 2 years now, so I think I understand or know a little bit about what goes on, and I'm not too, if you get like people that left Nigeria like 5, 10 years ago compared to Nigeria of today, it's kind of different. So I'm just 2 years away, and I think I can still talk about what happens in Nigeria and stuff. Um, so today's session will be quite straightforward and more of introductory. Obviously, like I said, we'll have more sessions coming up, and we'll be able to discuss and talk about more and more things. If you have any questions, you can pop it in the chat, live chat, and I will answer them as I see them as they come up on my screen. So yeah, you're welcome. And I'm just kind of skeptical about this thing. I'm not sure if you will record or not, but let's just see. I've not done one before. This is my first YouTube live session. I've done live on Microsoft Teams and Zoom, but for using YouTube, this is my first time. So today, and again, I'll be looking at my book here. I have a little jotter on my phone here. So I'll be looking at both of them to get some information as I need them. Okay. So today we'll be talking about, you might get confused about the title. Don't get confused, it's just quite similar. We'll talk about after RN, what's actually next. Because oftentimes, and I'm an example myself as well. After registered nursing in School of Nursing or university, you might be wondering what other career advancement have I got? What should I plan on? Obviously, you have several options. Some people have gone to the university to do maybe ODL, that's distance learning, or if they want to do maybe post basic, I think that will not exist anymore. They will now be doing postgraduate because School of Nursing is now moving to College of Nursing. And some are affiliating with universities so they can give degree rather than the HND. That's absolutely fine. But the question you might want to ask yourself, I don't know if you watching me as student or registered nurse, it doesn't matter. We'll cover everything, but we'll start with the students. So as a student, what actually do you need to think of when you want to plan after RN? The number one thing to think of is what actually is my future plan. Some people, believe it or not, they want to get married as early as possible, while some people think they want to put their career first. Some aim to have masters, PhD, so that's education. Some want to go into family, they want to start their family as soon as possible, because some people get to School of Nursing very at their old age, and family pressure, partner pressure, peer pressure, and everything might make them want to start their family as early as possible. So that's one thing. Another thing you might want to think of is, do I want to explore? Do I want to go elsewhere? Because one thing people don't know is that registered nurse certificate, that qualification is very strong and solid. It doesn't matter where you get it from. What matters is you can use it almost anywhere else in the world. Yeah, because nursing is like universal and international. So if you have your RN, that's what you need to get started, and you just need to apply to other boards like in other countries, and they will give you their requirements. Once you meet the requirements, you will get employed very well. That most countries need nurses to work because people are growing older, people are getting sicker, and they need someone to care for them. But there is a kind of downside to that. I won't say if you compare to Naira, I mean, I'm talking about money. I won't say if you compare to Naira, but if you compare to the living standard of that country, nurses don't get paid like that. I think what causes that is the manpower. Because you can't have one nurse to one patient for all units in the hospital. So you have to have more nurses than you need doctors and some other healthcare professionals. So, for example, now in an hospital, you may have 10 doctors and you may have like 100 nurses. So, if you look at how much those will cost, it might take a lot. So, really, to be honest, I think that's how it is generally in Nigeria. Nurses don't get paid that enough. In the UK, it's the same thing, but it's still better than nothing. So don't forget, I said you. What you need to think of is what actually do you want to do? What's the way forward? Do you want to start a family? Do you want to travel out? Do you want to start working, or do you want to go to school? And if you want to go to school, will it be in Nigeria or will it be abroad? So those are the questions. But I'm going to be specific about United Kingdom because that's where I'm registered, that's where I work, and I can talk more about it than other countries. If though I have little idea, but it won't be in depth as in what I know about United Kingdom. I hope you understand what I mean. So that's about it. That's the introduction for nursing students. But for registered nurse, if you are working already, you will also be thinking that what actually have I got to do? We don't work in the same area. We don't work in the same area. We don't earn the same money, and we don't have the same plan. Some people have planned that they just want to work anywhere that's available in Nigeria. Some people don't have plan to leave their country. That's absolutely fine. While some people have plan and their plan is to explore, to have Nigeria RN, to have UK RN, to have US RN, to have Canada RN, to just have all those RN to get tied to. That's absolutely fine as well. But what you've got to think about is each country have their requirements that you need to meet if you want to renew your license. For example, if you have Nigeria RN, UK RN, US RN, you can't practice in those three countries evenly or fairly in a single year. So if you want to renew, for example, if you want to renew UK license, you need you don't renew UK license, but we do revalidation. So if you want to do your revalidation, you need to have 450 hours of work in the UK, which I doubt you'll be able to do. If you have US, you have UK, you have Canada, and you have all these countries that you need to meet up their requirements before you can renew their PIN or before you do their revalidation or renew their license or stuff. So it's really up to you, but having others tied to doesn't mean they are more successful than you. Just find your safe place and just go with it. However, don't get too comfortable and you won't want to explore yourself. Okay. So that brings us to our first topic that we'll talk about today, which is UKRN overview generally. So UKRN, it, if you don't know the full meaning, because you might not know, I don't want to assume here, it means United Kingdom registered nurse or registered nurse in the UK, basically. And in the UK, you can work as a nurse in the NHS, that's the National Health Service, that's like government hospitals, and we provide free health care for people. Free technically, but not free. What I mean is, it's free because when you go to the hospital, you don't have to pay. It's not free because at the end of the month, you pay national insurance. So that's what I mean by free and not free. Then care homes. So I've talked about NHS. The next one is care homes. You have option of working in the care homes as well. Care homes are the one that look after elderly people. It's just it's a small building, so there are no like different units, different departments like in big hospitals. Also, you can work in private hospitals. Those ones are quite big as well, and they have units, but it's not as big as NHS, obviously. Um, so you have those options. What you might want to think of now is how do I get to choose which one do I want to work in? There is no absolute answer to where you need to work, but you can factor where you need to work based on some considering factors. For example, excuse me. For example, NHS pay is the lowest among these three categories. I mean, between NHS, care home, and private. So NHS is the least pay in terms of pay. So if you think money is what you need, basically NHS is number three. Care homes and private pay more and better than NHS. That's the fact. Um, so that's about payments. If money is what you need, then NHS should be a third option. However, if you need like experiments or you need to gain not experiment experience, if you need to gain experience, then you might be thinking of UK. Why? Because in the U in you might be thinking of NHS. Sorry, why? Because in the NHS you have this. It's a big hospitals. We're talking about some trusts do have like 600 beds. Some have up to 800. Some have up to 1,000 beds. So you can think of those departments. Those you can float around and walk here now and say, yeah, I'm tired here. I want to work elsewhere tomorrow. That's possible in the NHS. However, in private, because it's not that big, there are no options for you to just move like that. Same in care home, no options. You just have to look after adults or become the senior. Um, so that's just about it. If you think you need to explore different departments or you need to gain experience, then NHS ranks first in this category. Another thing to look for is benefits. So when I say benefits, I mean what the companies or the employer offer you for working with them. So NHS is a big organization. Their pension, NHS pension, is known to be the most secure pension, or how do I the most profitable or secure pension. I don't know. It's the main cocoa pension in the world and is among the best pension in the world. So that's NHS pension. The next one is sorry, just need to miss this because it's distracting me. So apart from the NHS pension, in NHS you also get some discount. I don't have the card here, so call it blue light card, and that card literally mean when you go for shopping or when you go to buy something, you get some discounts. Maybe sometimes 1%, sometimes 5%, sometimes 10% discount just because you are NHS worker. Some people appreciate that, but you don't get to see that often in home care, sorry, in care homes or in private. So that's another category that you need to judge from. Then the last one is career progression. So in the NHS, as I said, because it's a big organization, so we have all this specialty. You might be in a particular unit and you might have up to like 10 or 15 specialty working in that particular unit. So I mean you can just the career advancement in NHS is really good because one, you don't have to bribe or know anyone. Just do some online trainings, online courses, gather everything together, go online and apply, go for interview. If you pass it, you get the job and you move to that role. So let me give you an example because you might be wondering what is this saying? So I work in the endoscopy, but before I come to endoscopy, let me use digestive ward as an example. So like in the digestive ward, if you are just working in digestive ward, you they have different specialty that come to look at patients. We're talking about maybe peg nurse, we're talking about nutrition nurse, we're talking about dietitian. So all these specialties are just there for people to do, and you do the specialty, you get promoted, and you start offering that service. And yeah, that's it. That's an advancement. So that's about digestive. Like I work in the endoscopy. The career progression in endoscopy is you can become nurse endoscopist, you can become a peg nurse as well, You can become band six. You can become band six and do some admin works, with a manager, like doing roster, doing coordination and stuff like that. And you can become specialist in some particular procedures as well. So that's what I'm talking about. You have that options and that specialty which you might not get in private or in care homes, because they are not that big and they are not that wide or broad for you to swing here and there. Okay, so that's all about NHS, care homes, and private, basically. Now, I'm going to talk about why. Why actually do I think that you should come to the UK? Why? What do I mean? I've talked about the career advancement, right? The next one I'll talk about now is the pay. Like, let's compare. Okay, before I talk about pay, let's just do some basic comparison about on nursing in Nigeria and nursing in the UK. So we'll do quick comparison and we'll see for ourselves the major differences between nursing in Nigeria and nursing in the UK. The first one, pay. Obviously, the pay rate in the UK is more than pay rate in Nigeria. So in the UK we use bands to judge. In Nigeria we use level, like Cohen's level. I know I start from level 7. So in UK it's bands. You start from band 5 and you can get up to band 9. So band 5 salary, I'll be quoting here. Band 5 salary from April 2023 is 28,407, while band 9 salary is 114,000. So you can see the difference from 28,000 to 114,000. That's from band 5 to band 9, and you just start progressing. In Nigeria, we start from level, which is level 7. And level 7, I think the last time I checked, because I'm not quite up to date, because I get conflicting data, so I'm not sure which one exactly to stick to. But the last time I checked, level 7 is about 100,000, 120,000 naira. And then you can progress as well. So, but the I think what makes the pay so different and so distant to each other is the exchange rate. For example, before it used to be like 300, 400 pounds to naira. Now, today is about 1,000 naira for £1. So, if you, before, let's say if you used to save like £500 and you use that £500 to convert it to naira, before you might get like 200,000 naira. But now the exchange rate is on another level. If you change that £500 that you used to save monthly to, if you convert it to naira, you'll be going to like 500,000 naira. So you can see the difference is just massive, and that's what I think makes the difference between working in Nigeria and working in the UK, because of the exchange rates with the payments and stuff. Um, some people are benefiting from it. I can't deny the fact, but I think the government needs to do something about it to at least bring it down a little bit. 1,000 naira for £1 seems quite a lot, and it's not good if it keeps going down, because you and I know if something goes up in Nigeria before it comes down, it takes lots and lots of effort. So that's about the pay comparison. Uh, Another thing is career progression. I've mentioned career progression in the UK, but what does career progression in the UK versus Nigeria? What does it look like really? So as I said, in the UK, you can work in the NHS. I mean, there is always vacancy available, unless you don't want to do a particular one available. There is always vacancy available of what you can do and some units you can work in. Um, but in Nigeria, I know some people want to work, I mean, in federal hospitals, but before you can work in federal hospitals, it takes lots and lots of effort to do exams, and you get to know some people before they can push your file. While in NHS, you don't have to do all that. All you need to do is just apply for work and do interview. For example, I just changed my employer recently. I didn't know anybody here, obviously. I just apply online. I was just checking. I just applied online, and I got interviewed online as well, and I just moved. So that's it. But in Nigeria, you need to do first of all consider the indigene first, then um, they will consider if you know someone or this kind of thing. So it's really difficult to move from one place to another in Nigeria in terms of nursing. I mean, I'm talking of government hospitals. For private, it's quite straightforward. You just go. Some privates will not even do interview for you. You just resume and you do, because they're not paying as that much as the government hospitals will pay. And another thing here is the UK will not owe you salary. It doesn't matter if you start today or tomorrow. From the day of your arrival, your salary starts counting. So I know in Nigeria, some federal hospitals we have to wait for 4 months or 6 months before they will start paying you salary. I mean, what do you want people to depend on in that period of 4 to 6 months? People wait, people will travel, people will buy things, but yeah, it is what it is. But you don't get to see that in the UK. You work, you get your money, you work, you get your money. No one will owe you salary. The another difference is cost of living, really. So in the UK, you have cost of living meant for the UK, obviously, and in Nigeria, you have the one meant for Nigeria. And a good example is how we pay bills. So in the UK, we pay bills monthly. Most bills are monthly. In Nigeria, I think most bills are annually. House rent, as a good example, in Nigeria, you pay house rent annually, but in the UK, you pay house rent monthly because the price is just ridiculous, and depending on your area though. But yeah, you pay that monthly. So I haven't talked about that. The next thing I'll talk about is registration and license processes. So in the UK, to work in the UK, obviously you need to get registered before you can work as a nurse. You can work as maybe social worker or healthcare assistant, which we call ward aides in Nigeria. But in the UK, before you can work as a nurse, you need to have your PIN, and the PIN is similar to the license that we use in Nigeria. Just that here you're not carrying any plastic card or anything. It's just your PIN number, and they can get all the information that they need. Okay, so before you can work in the UK, sorry for those of you that already know the UK processes and stuff. Don't get offended. I'll just brush through this part so that people that have no idea can get themselves familiar with how it works and what they need to know and stuff like that. But I won't take much of your time, trust me. So the first thing you need to be aware of is obviously you need to get registered as a nurse. So you need to be registered in your home country before you can apply. Then the second thing, after you've become a nurse, you've graduated, you have a license and everything. Next thing you need to do is apply to the UK. Is like you want to start, you should start. You get to pay you upload the document and your certificate. You fill the online form and you pay the application fee. The application fee is £140. Again, before the £140 is about 60,000 naira, but now is about 145,000 naira. So that's more than double. In the space of I'm talking in the space of just 3 years. It's more than double. So um yeah, you get to pay that £140. After paying that £140, you get an email. Sorry, before I go forward, if you don't know how UKRN, how to apply, how to get started, or what you need to know or anything, my book is available. um i'll drop my I'll drop where you can get it from in the chat so you can get it, or you can message me on YouTube. I think you can do that, or comment on any of my video and I'll reply and tell you how to get it. So it goes for 1,000 naira for students and 1,500 for registered nurses or any other person. Okay, thank you very much. So going back to the step-by-step guide, after getting the email of the application and of the £140, you apply for verification with your nursing board, in this case, NMCN Nigeria. So you pay them as well. It used to be like 5,000 between 5,007 and then 12,000, but now it's 68,000, or let's say 69,000 really. So you pay that, you get verified in about 2 3 weeks because it's not online. So everything is contained in the book. Don't worry. If you just need the book, just let me know. I'll get the book across to you. It's PDF. You can read it. You can follow the guide. It has pictures and everything for you to get started from start to finish. Basically, it's about 35 to 37 pages, I think. So it's a really detailed book. After getting verified by NMCN, then you continue your NMC journey by sitting for CBT and by doing the IELTS or OET, that's English test exam. I mean, we speak English, but they still need to test our ability to communicate effectively in English, especially in healthcare settings. So, in case of that, don't get worried or anything. And just to emphasize this, because I've seen some people doing the IELTS general exams, that's just a waste of money. You need to do UKVI academic or IELTS academic. So you can do either of the two, they are both accepted, or you do the OET. Please don't do the general. It's just waste of time for you. Waste of time and waste of money because their exams are not the same, and you just waste your money. You can't get a refund for the exam you've attempted, and it's just waste of time that you used to prepare for that general when it's not the same thing as academic. Okay, so we've talked about that. Another thing I would like to talk about is the working hours. So in the UK, we have the working hours quite vary, but it's not that varied like in Nigeria. You know, in Nigeria, some will want you to work 5 days in a week, but in the UK, because we get paid per hour, we work per hour. Okay, so in a week in NHS, the standard working hours in NHS is 37.5. That's like 3 days or 4 days, depending on where you work. They will just split it to make sure it's 37.5. If they owe you, they will let you do shorter day at some point, or if you owe them hours, they will let you do extra. So they shall find way to balance everything to make sure 37.5. If you add it in a month, everything comes to a total number. I think it's 168 or 160 something. I can't remember, but yeah, 37.5 times 4. Because sometimes it's the month is more than 4 weeks, and sometimes it's less than. Is it less than 4 weeks? Just take it like that, but it's just 37.5 per week. Okay, that's how you get paid. Um, but in some cases, like maybe in care homes or in private, they might ask you to do 40, but it's still that you get paid per hour. You're not getting paid per days of work or anything. You're getting paid per hours that you work, and whatever is on your contract. Just make sure you read it very well before you sign it. All right, so I've talked about that. Now, what are the challenges that are in the NHS or that are in the UK? Challenges of working in the UK. Excuse me. The first one I'll talk about is what is the reason why they want you to come and work for them, and which is shortage of staff. Okay, so every day the shortage of staff thing is not now. It's not a recent thing. It's been going on and on and on and on for years because um one of my colleagues, when I was having this discussion with her a few days ago, he said it's been like that for years now. Not actually due to COVID, so it's been like that for years, but they got worse during COVID than expected or than planned. So that's why, and that's why they want you to come and work for them. So shortage of staff is the main challenge. So because there are shortage of staff, you might be asked to do extra, to do overtime, to stay more than planned, more than your shifts, but you still get paid for how many hours you worked though. And shortage of staff as well might mean that we have less staff on duty, so you do more work than you're supposed to. Um, of course, Most times that won't mean that you earn more because you're not getting paid by how many patients you look after. Unfortunately, you're getting paid by how many hours you work. So it doesn't matter how many patients you look after, you still get paid per hour. So it might be because of the shortage of staff, it might mean that you have to look after more patients that you need to. So that's another thing, and it might mean that you have to stay extra. You don't have to. You can say no. If you're tired, if you are sick, or if you have other plans, you can say no. But yeah, when they say, yeah, we'll pay you extra, we'll pay you overtime, yeah, still consider overtime 2 hours. That's a lot. Yeah, I'll just stay for 2 hours and that that one will go. So that's what most people do overtime because the overtime rate is different from the normal rates. If let's say if you work 10-hour shifts, they want you to do 2 hours overtime. The 2 hours overtime rate will be different from the normal rate. Some trusts do double of your hourly rate. That means if you do 2 hours, they will pay you for 4 hours. But some do 1.5. So it varies really. But it's definitely more than your normal rates. Okay. So that's about short staff. Another challenges is obviously the cost of living. So the cost of things are getting more and more expensive now. I've been here 2 years, and I can really tell the difference. In Nigeria, if they say cost of living is increasing, um, you don't. I don't understand how to say it, but you don't really see it that way. You just think, yeah, fuel is dollar is rising, but here pounds is more than dollar, so I don't know what's rising anyway. So we can't blame dollar here because dollar is obviously more than pounds is obviously more than dollar. So we can't blame dollar here. But then the cost of living is rising. Is truly rising. So in the UK is about 8.7%, but it's not like in Nigeria. Nigeria cost of living is about I think 13 or 22. I'm not quite sure, but UK is 8.7. So that means if you buy something last year, this year is 8.7 more expensive. If you buy something one, let's say £10 last year, now it's 8.7 increase. And that means you will pay more to get the same thing. So the cost of living as well, it also matters depending on where you live. For example, if you live somewhere that's quite expensive already, then the cost of living will hit you really hard. Let's say you live in London, or you live around London, the cities around London, like Portsmouth, like Brighton, like Croydon, Croydon is quite cheaper, but Croydon is quite expensive, like Bristol, like Oxford, all these cities like Reading, all these cities around London, they are particularly expensive as well. So, but if you move like somewhere in the north, in the Midlands, or stuff like that, when I say north, I don't mean Kano, please. Yeah, but not in England. So yeah, things are quite cheaper up north, and that means even if the cost of living is high, but the problem there now is the cost of living the rise in cost of living, is general. That means it affects everyone in the UK, but you still get paid the same rate, basically, except if you're in London or I think Croydon or Crawley. I don't know. But you get paid the same rate, but the cost of living is rising. That means people in the north are spending like 1,000 in a month. You in the south are spending like 1,500 in a month, and you still get paid the same salary. I think it doesn't really make sense, but that's how it is. So if you are planning to move to the UK, try and figure out where the area is, what's the cost of living in that area, and try and work out if you have options, if you have alternative, then go for it rather than staying in that expensive area. However, don't use that to judge if you've only got one option. Reason being that it's very difficult, not quite anymore. It's very difficult now to get a job because of the WHO restriction. So because of that, many people, many trusts, most trusts don't recruit from Nigeria. or from Africa, from some African countries. They now focus on like India, Philippines, and stuff, and Middle East. So because of that, if you have a chance to get a job offer or COS, no matter where the location is in the UK, you can come first and then find your way to move to a cheaper area if you think that area is too expensive for you. But people are still living in those areas. Some people like it, but if you think you want to save a lot, then you might probably move. Another good thing to that side is that most trusts won't trouble you if you want to move. Like they are not like in Nigeria. If you want to move, I can remember from one of my previous jobs in Nigeria, like I had to move before without even informing the MD. I already moved before I told him that yeah, I'm not coming back. That's how it was. But in the UK, like you can tell them you move. They will even celebrate you that you are leaving. You've got a new job. They will celebrate you, give you presents, give you cards, do some contributions for you depending on where you work. And yeah, you will not be like these people are short staff. Why are they celebrating because I'm leaving? I thought they should like owe me 1 month salary. But yeah, you have your right to choose where you want to work. You can't get stuck or anything. However, some trusts just read your contract very well. Some trusts might ask you to pay a percentage, the money they used to bring you in before you can go. But some trusts just don't care. You can and go if you want. It's fine. So yeah, that's how it is. If you get any offer, if the area is quite expensive, just come in. After a couple of months, after a couple of years, you can move. I mean, don't think that when you come in, everything will start getting rosy immediately. Try and adapt, understand the culture. Again, before you move, don't come in and jump to move. Try and stay there first. Get that experience, very important. Try and understand the area, understand how they speak, understand how NHS work, understand how the system works generally, and then you can decide if you want to move or if you want to stay. Because if you move and let's say you are moving from because everyone is not the same, all units are not the same. Let's say you are moving from a friendly unit because it's quite expensive, and then you move, it's like frying pan to air or frying pan to fire. So, and then you now move to an unfriendly environment. You want to move again, and that's not really good. Like you just came in and you're just moving, moving, moving. So take your time, understand people, understand how it works, and then you can make decision. All right. So that's about that. About cost of living, about opportunities of coming to the UK. If you are a student in Nigeria or you are RN and you're looking towards moving to the UK, there are some opportunities that you need to know about. The first one I've talked about it, which is career progression. You can, as soon as possible, move to an area. As long as you qualify for it, you don't need to pay anybody, you don't need to know anybody. Just apply for it, attend interview, let your qualifications and your application form speak for you. Put all the courses, all the online courses. So there's this thing. Online courses are very useful in the UK. All these short courses that you can do for 30 minutes and stuff, they are very useful and don't take them for granted. So use that to build your CV and just apply online and get interviewed and yeah, you get the job. So career progression is really, really a good thing. You can progress easily. I mean, yeah, just name it. If you think because nursing sometimes can be boring, depending on where you work. Like if you're doing the same thing every day, every day, every day, you might get bored. So with this specialty thing, it makes it a little bit more interesting. If you think you know how to teach, you can move into education. You can move to research. You can move to maybe practice development or stuff. You can move to nutrition, you can move to team viability, you can move to administration part, um, or you can move to bed manager and stuff. So depending on actually what you want to do, just figure out what you want to do and ask people around, and then you can get there from there. So career progression is one of the opportunities that you get when you move to the UK. The second thing that you get is no one will owe you salary, and they have like organized minimum wage in the UK. Like in Nigeria, since the era of Buhari, they said the minimum wage should be 30,000 naira, but up till 2023 now, today is 8th of July, some states are still paying 18,000 naira, the old one, while some are even any less than that. Like if they're doing teaching in primary schools, all this, all this private, small private schools, some are getting paid like 8,000, 10,000 naira in a month. So in the UK, we have like organized minimum wage. Like if you are a professionals, you can't earn less than that minimum wage. Unless if you are doing like maybe you're offering service like all these engineers, plumber. So those ones are different. But if you are working like you are working in the NHS, you are working in any hospitals, you are working for companies, yeah, you can't earn less than the minimum wage. And the minimum wage is £10.42. So you can't go below £10.42. In NHS, the basic band five rates now I think is 16 or 17 pounds. I can't remember from the last pay slip, but I think it's about 16 or 17 pounds per hour. That's per hour. Before tax, yeah. The tax is one thing as well. I beg. Um so I've talked about career progression as one of the opportunities. I've talked about no one will owe you salary. And the next thing I'll talk about is experience. Obviously, the way we practice in Nigeria is different from the way we practice in the UK. So that experience is there as well. If you think you want to get experience, you want to be exposed, you want to get that exposure of working in the UK, working in, because UK is an advanced country. So they have that equipment ready. What happens is they really invest in healthcare here. So they have that equipment that you need to work, because the healthcare service is free. So you are not limited. I'm not saying you should waste, but you are not limited to, for example, in some hospitals, they will count what you need to use. Like this is what you need to use for this one. But in the UK, like there are some for training purposes, some for research purposes, some that you just used and it won't fit for patients. And we have lots of single-use items here. So like there are lots of equipments, instruments that if you want to try out, you can try. And I really don't think there's anywhere in the world that you go and say you've practiced as a nurse in the UK and they will look you down. So because that name is just there. And you get to be exposed. Because to be honest, to get good healthcare, quality healthcare is quite expensive, honestly. When I have time and I'm just going through the prices of what we use for patients, it's really expensive. So I can imagine what goes on in private hospitals in Nigeria, and why healthcare is quite expensive, and people just think, yeah, they just put price and stuff like that. But to get quality healthcare is quite expensive, really expensive, quite expensive to be honest. So yeah, that one is there. Career progression, no one will owe you salary, experience. From the challenges, I didn't mention one thing, which is the deductions. So it's one of the challenges that you might face when you get to the UK and you'll be like, oh, my salary is this and my deduction is this. How come? So don't get shocked. Number one thing, healthcare, you pay it through your national insurance, and that one will get deducted from your salary. Number two, you pay pension. It's not compulsory, but they will put you in by default. So if you don't want it, you can opt out. If you want it, you just leave it and it continues. So they take pension, which for band five they take I think 7.7 or 9.8, depending on your tax code. 7.7% or 9.8 of your salary. That's what they take for pension. For national insurance as well, that one is for you to have access to healthcare, free healthcare. It doesn't matter how much it costs or how many times you need it, but it's going to be free definitely. You won't have to pay anything. And that's one of the advantage that UK has over United States. Like in the US, I was watching a video on YouTube. Sometimes, sorry to bore you with this, but the if you know what healthcare cost looks like in the US, you'll be like, wow. Wow, so people pay this just to have health care, like ridiculous charges. For example, if you want to have delivery, which is the common thing. I mean, if you want to have family, you have delivery. Normal delivery now, I'm not talking about CS. It varies from $12,000 and it goes as high as $44,000. So you fit yourself between 10,000 and 44,000. That's if there is no that means 10,000 will be like if there is no complication, you just deliver and you are going home. But if there are complications like bleeding, they need to do episiotomy and all this stuff, then your money is going. But in the UK, you don't have to worry about that or anything. You just go to a hospital, deliver, and go home. So that's it. That means if you want to deliver in the US, you need to have insurance, which you will pay every month, and the insurance will not pay 100%. So that's it. You have to pay parts, and your insurance will pay parts. But in the UK, you don't have to pay that. Just pay your national insurance, and everything about healthcare is free. Unless if you want to collect medications, you pay £10, £9.99. If you have prescription. But other than that, in the hospital, like surgery or anything, or they are treating cancer, or you have um, fracture or RTA or anything like that, everything is completely free. Okay. Um, so yeah, I'm talking about the deduction. So the deduction is quite a lot, and after that, they charge tax. So the tax, it also depends on your tax code, but most people like in band five, they are normally on 20% tax code. So they'll take 20% of your salary. I know you don't want to hear that, but yeah, that's how it works. When I say 20%, don't start to calculate, yeah, how much you doing monthly, and I'll take 20% of that. That's not how it works actually, but that's what people say just to scare people. The 20% is actually, so I mentioned, let me try and let me try and explain so that you can understand. Excuse me. So I mentioned tax code. The tax code will mean how much they will deduct from your salary before the tax hits. Okay. For example, you might have tax code that will be 1257L, 1257L, yeah, or my own currently is 1087L. So that will mean that 1257L will mean that they will deduct 12,000 one yeah 12,570 from your salary, and then the remaining will be what they will tax. So let's do the basic calculation so that you don't get confused. Let's say my tax code is 1000L, okay, and I'm earning 20,000. That will mean that they will deduct that 1000L. So if it's 1000L, that means it's £10,000. Okay, that L will change it to zero. That's how they do it. So if it's 127L, that will be 12570. But let's use my own example, 1000L. So that will be 1000. You add 10, so that makes it 10,000. And let's say I'm earning 20,000 in a year, not in a month now, in a year. So they will now deduct that which my tax code says 10,000. They deduct it from my money, which is 20,000. So I'll be left with 10,000. So is that 10,000 that they will deduct 20% every month? Okay, I hope you understand. Well, that's how they do it. They will remove your tax code from how much you earn, and then the remaining is what they will tax. So it's not that they will tax 20% of everything. That would be ridiculous though. So yeah, that's that about that really. And then the next thing I'll talk about is, let me just have a look, is diversity and the cultural expectations in the UK. So in the UK, you already know they accept and employ people from different countries. So if you move to the UK, that means you have the opportunity to meet with other nationalities, and you can share ideas, you can start community and stuff. Okay. For example, in the UK, so far I've met British, definitely. I've met Americans. I've met Filipinos. I've met other Africans like Ghana, Zimbabwe. Um, where again? Yeah, Ghana and Zimbabwe mostly, and Uganda. Yes, I've met some Ugandan as well. Um, I've met Indians. I've met Italians. I've met Romanians. I mentioned British already. So I've met all those people. We have conversation, we talk, and all this stuff. And even in the UK, it's my yeah. I've met other parts of Nigerians as well, like people from south, from southeast, from the north and stuff. In Nigeria, I'm from the west. I'm from southwest, so I don't really have that close conversation with other professionals from other areas like from the north or south. But here in the UK, because we need to build that community, you need to relate with people at work. So you have the opportunity to meet with people, and if that's what interests you, yeah, why not give UK a try, or other countries like US or Canada. But yeah, I'll talk about UK because that is what I know. So the next thing I'll talk about now is support and resources. Support and resources in the UK, you can easily get lost or you can easily waste your money. When I say get lost, I don't mean when you are going to somewhere. I mean when you want to do something, you might not understand it unless you ask someone. So that's where support comes in. The other one, when I say you might waste your money, is if you want to do things again. I mean, maybe if you want to buy something, or you get or you need an information or something, you might just spend your money where you don't even have to spend it. So all these are what brought up communities and support groups. So we have support groups, we have communities of maybe the same area, like there's the Nigerian community, there's an African community, there is an NHS community. All these communities are where people just share ideas. So for example, if I'm looking for where to get Niger food, when next I go to Sheffield, that means I'll just put it on the group, because if I put it on Google Map, yeah, they will have lists, but I won't know which one is the best, because some people can write even fake reviews on Google Maps. But if I ask someone directly on the group which restaurant is better for Amala and Gbegiri, you know what I mean? Yeah, so people can easily recommend. So that's where support comes in. And for example, maybe if you want to buy a house and you met someone and they are telling you to bring ridiculous amounts, if you put it on the group, you might have someone that already passed that stage, and they will give you their advice. So that's where support comes in. You get that a lot in the UK. In Nigeria, we do more of physical, but in the UK, we do more of online or social media community. So I don't even know my neighbors. I live in a multi-terrace house. I don't know the neighbor here. I don't know the neighbor on this side. I'm just in the middle. We don't know ourselves. If I see them tomorrow morning, I won't know they are my neighbor. So in the UK, they do more of online rather than physical. It's just like minding my business. Everyone is just minding their business. They are too serious in this country. So, and then for the support, as I said, online is very good. You can go online. So in the UK, they have this government website where you can find, oh my God, that website is so complex that you can find literally anything you need to know about UK. So it's gov.uk. It's just a simple website. A simple name, gov.uk. That website is very complex. You can get almost everything, almost all information that you need. Like if you want to apply for visa, you do it on Gov website. If you want to apply for driving instructor, you go through Gov website, government website. If you want to apply for, I don't know, maybe council tax, if you want to apply for benefits, if you want to apply for, just name all these things that you do to the government. And if you want to check your tax status, you need to go through and government. So that government's website has lots and lots of information. In case if you can't remember, it's gov.uk. You can find all the information that you need there. Really. um, so this is 1 hour gone. I'll just, just give some roundups now. Um, you might have had some people saying, yeah, if you have money in Nigeria, well, you just stay back, don't come to the UK, because if you come to the UK, you become more poorer. To be honest, I really will not 100% agree with such people for some reasons. And the number one reason is, if you think that way, why have you not gone back to now? I mean, if you think it's more better, you can go back there and see how it is. And the reason why people say this is, some people left Nigeria like 20 years ago, they already have British citizenship, and they still think that Nigeria is the same as they left it, or it's even better as they left it. But the reality says opposite. I mean, I left Nigeria 2 years ago now, and I can really say about how I left it. I can't say about what's exactly going on ground in the next five now, or even in the next 5, 10 years. So all these things are what people don't really consider. They've left Nigeria for long, and they just think, yeah, if you have money, just stay in Nigeria. People need to really understand that in the only reason why people come to the UK is not just because of money, because some people are actually comfortable in Nigeria and they still move to the UK. You can name it any, I won't say any, but most of even our politicians that are rich and they have all this money, even though most of the money is not coming from their salary, but they have that money. But why do they send their children to UK schools? Why do they buy a house in the UK? Why do they come for UK for treatment? So those are things that such people should really consider, and not just, yeah, if you have money, stay back in Nigeria, don't come to the UK. No, I won't say that, because I won't agree to that. If I have money, I won't say I will stay. I don't know, but yeah, I don't think. I mean, you can name it if you're looking for that career advancement, if you're looking for that progression, if you're looking to have that second passport, so you can travel almost everywhere you want without getting intimidated by the customs. So all these things are what we need to look for, to look at really. And then some people also exaggerate when they talk about UK. Like, yeah, the UK is not the best country in the world, obviously, but then you can't fully compare UK with Nigeria. I mean, you can't really compare the UK with Nigeria. So UK, the way I see UK is like a free land, and it's like an open feed, really. So UK is like an open feed. They'll just pay you money, and you do what you want with your money. You do what you if you want to drive. If you want to drive, you pay for your car, maybe installments, or if you have full cash, you can pay cash. If you want to buy a house, you can't. It's difficult to buy a house in cash unless you are from a political family. So because the house is about 200,000 pounds plus. So where will I see? Where do I keep 200? That's like 200 million. I don't have that money. So you have to pay like every month for 20, 25, 30 years before you can say, yeah, this is my house. But so if you want to do that, you have to work extra. If you want to drive a nice car, you have to work extra. If you want to use latest phone, you have to work extra. But there are some things that you don't need to worry about, like electricity, there's light, there's water. You pay your bills, but you still pay your bills in Nigeria as well now. So it's just the bill is just different because the minimum wage too is different. So I don't really see. I think the UK is just like an open feed. You are coming blank, and you get salary here, and you plan what you want to do with that salary here. So you know that your expenses should not be more than your salary. So you need to figure out how to balance everything, and you'll be fine. There are people here that they've been here for years. They already have business in Nigeria. They have houses in Nigeria and stuff, and they just living fine. So, and the another thing is, as I said earlier, in the UK you get paid per hour, and in Nigeria you get paid per number of days that you work. So that means if you need extra money to do a project next month, what does that mean? You do extra work. That's it. In Nigeria, some people want to work, but the job is not there. They don't have that job. And yeah, that's it. Another thing in the UK is you just need to cut your shoes according to your size. So cut your shoes according to your size. Don't let anyone fool you. You know where you're coming from. You know what your plan is. Just tailor what you need to what you earn, so that you don't go in debt, because it's really easy to get into debt in the UK. They'll bring this offer, yeah, take this, pay monthly, take this, pay monthly, and before you know it, what you'll be paying monthly is more than your salary, which is not really good for you. Okay. So yeah, this is where I'll put a full stop to this. And then if you have any questions, you can drop a comment on this. If you don't have any questions, you can contact me directly on my through my website. I will leave my website link here. I don't want to leave my all my details that public, but website is fine. If you need to get in touch with me, just go through the website and you will find me. And if you need to get the book, let me put it there. My website. So that's my website there. And if you need to get the book, go to how to become a UKRN book. So you can get this book on shop.bookmark.org. I hope I'm correct. Yeah, so get the book there. Let me put the price. So it's 1,000 naira for students. I might did I type correctly? I can't see. Yeah, I know that's not right. So 1,500 for students, and no, 1,000 for students and 1,500 for others. Okay, so if you want to become a UKRN, buy my book and you'll be fine. So I've put everything in the chat section, and yeah, that's it. If you need to contact me, go through my website. If you need to buy the book, the link is there. And I hope you all enjoyed this section. If you have any questions, again, drop in the comments, and I'll see you in the next planned session. Bye, and thank you for coming. Thank you for watching. Bye bye.